What is the current state of healthcare staffing in your organization? As we dive into this question, we find ourselves in a dynamic landscape, one that is constantly evolving due to various factors. The challenges within healthcare staffing are multifaceted, ranging from staffing shortages to high turnover rates and seasonal demands. Yet, amidst these challenges, we see the emergence of innovative solutions that are reshaping the healthcare industry. The rise of telehealth, for instance, has ushered in a new era in healthcare delivery, with the potential to address some of these staffing issues. It's not just about providing care from a distance, but also about maximizing healthcare resources, extending the reach of specialized professionals, and offering a flexible working environment. We're also seeing an increasing demand for specialized healthcare professionals. As medical science advances, so too does the need for specific expertise. This demand, however, also brings its own challenges. How do we ensure we have enough cardiologists, nurse practitioners, chiropractors, and optometrists to meet this growing need? And let's not forget the impact of the global pandemic. COVID-19 has tested the resilience of healthcare systems worldwide, forcing rapid scaling of the workforce and utilization of telehealth services. It has also demonstrated the potential for international cooperation and staff sharing in times of crisis. But innovation isn't just about responding to crises or filling gaps. It's also about embracing new technologies and processes that can streamline staffing. From software that simplifies scheduling and shifts to artificial intelligence applications that can predict staffing needs, the future of healthcare staffing is digital. Yet with these innovations come legal considerations. Complying with labor laws, navigating healthcare regulations, and maintaining safe staffing ratios are all critical elements that must be observed. Diversity, too, plays a crucial role in healthcare staffing. A diverse and inclusive workplace not only enriches the working environment, but can also lead to better patient outcomes. Finally, effective staff management and the role of staffing agencies are key components in this complex puzzle. They play an integral part in attracting and retaining top talent, managing mental health and burnout among healthcare workers, and understanding the economic factors that affect healthcare staffing. In this video, we will explore these challenges in depth and discuss the innovative solutions being implemented across the industry. What trends are shaping the healthcare staffing industry today? As we peel back the layers of the healthcare sector, we see a landscape that's constantly evolving, driven by innovation and necessity. Let's take a closer look at two key trends that are reshaping the industry: the rise of telehealth and the increasing demand for specialized healthcare professionals. First off, telehealth. This isn't a new concept, but it has gained unprecedented momentum in recent years. Imagine being able to consult with a healthcare professional from the comfort of your home, or having a follow-up appointment without stepping foot in a clinic. That's the power of telehealth. It's transforming the way we deliver healthcare services, making them more accessible, efficient, and patient-friendly. But telehealth doesn't just change the way we access healthcare. It also changes the way we staff our healthcare institutions. We're seeing a surge in demand for professionals who are not only adept in their field, but are also tech-savvy. These are individuals who can navigate the digital landscape with ease, bridging the gap between healthcare and technology. On the other hand, there's the increasing demand for specialized healthcare professionals. Gone are the days when a general practitioner was a one-stop solution for all health concerns. Today's patients are looking for specialized care tailored to their unique needs. This has led to a surge in demand for professionals with specific skills and expertise. Whether it's a cardiologist, a psychiatric nurse, or a medical assistant, the need for specialized roles is more apparent than ever. But this demand comes with its own set of challenges. It's not just about finding the right people to fill these roles, but also ensuring they have the necessary training, qualifications, and support to thrive in these specialized positions. It's a complex puzzle that requires strategic thinking and innovative solutions. These trends are reshaping how we think about healthcare staffing, requiring us to adapt and innovate. As we navigate this new landscape, we're learning, growing, and paving the way for a future where quality healthcare is accessible to all, no matter where they are or what they need. The journey may be challenging, but the destination is worth it. What key challenges are healthcare organizations facing when it comes to staffing? Let's delve into this. Firstly, staffing shortages are a significant hurdle. The healthcare industry is grappling with a growing demand for services, but a dwindling supply of professionals. Many factors contribute to this shortage, including an aging workforce, increasing patient population, and the growing need for specialized care. These shortages can lead to overwork, burnout, and decreased quality of care, creating a vicious cycle that is hard to break. Secondly, high turnover rates are another challenge. The stress and demands of healthcare professions often lead to burnout, causing employees to leave the industry altogether or switch jobs frequently in search of better work-life balance or higher pay. This constant flux of staff can disrupt continuity of care and increase recruitment and training costs for healthcare organizations. Thirdly, seasonal staffing demands add another layer of complexity. During flu season or a health crisis like the COVID-19 pandemic, the need for healthcare professionals can skyrocket, stretching resources thin and putting additional pressure on existing staff. So, how can healthcare organizations respond strategically to these challenges? Here's where innovation and adaptability come into play. To address staffing shortages, healthcare organizations can invest in education and training programs, creating a pipeline of skilled professionals ready to enter the field. They can also leverage technology, such as telehealth, to extend the reach of their services and alleviate some of the demand on their in-person staff. Mitigating high turnover rates requires a focus on staff well-being. This can be achieved through measures such as providing competitive salaries, flexible work schedules, and robust support systems to help manage stress and prevent burnout. Finally, to handle seasonal staffing demands, organizations can develop contingency plans, including the use of temporary or contract staff and strategic scheduling to ensure adequate coverage during peak times. These challenges require strategic responses that are adaptable and forward-thinking. And as we navigate the evolving landscape of healthcare staffing, it's clear that the solutions lie in a combination of innovation, investment in our workforce, and a commitment to caring for those who care for us. How have healthcare organizations adapted their staffing strategies in times of crisis? This is a question that has been at the forefront of our minds, especially in the wake of the COVID-19 pandemic. During these unprecedented times, healthcare organizations worldwide had to be agile, innovative, and proactive. They had to scale their workforce rapidly to meet the surge in patient needs. Many organizations even had to transition their staff into roles they had never filled before. It was a testament to their flexibility and dedication to patient care. Telehealth services also rose to prominence during this period. With lockdowns and social distancing measures in place, healthcare providers had to find a way to reach their patients. Telehealth was the answer. It allowed medical professionals to provide care remotely, reducing the risk of virus transmission and ensuring that those in need could still receive treatment. By integrating telehealth into their staffing strategies, healthcare organizations were able to maintain care continuity even in the most challenging times. However, these challenges weren't tackled alone. International cooperation and staff sharing became a significant aspect of healthcare staffing strategies. Countries around the globe came together, sharing resources, knowledge, and personnel to combat the crisis. This spirit of global unity and collaboration was a silver lining in the dark cloud of the pandemic, showcasing humanity's ability to come together in times of adversity. Innovative staffing strategies like these weren't just a response to the pandemic, they've become an integral part of the new normal in healthcare. They've shown us that with the right approach, we can adapt to any challenge, maintain high levels of care, and even improve our services. These adaptive strategies have proven essential in navigating the challenges presented by the pandemic and other crises. As we move forward, healthcare organizations will continue to learn, adapt, and innovate, ensuring that they're ready for whatever the future may bring. How is technology transforming healthcare staffing? We're living in an era where technology is rapidly evolving and reshaping every sector, and healthcare staffing is no exception. The introduction of innovative technologies like staffing software, artificial intelligence, and mobile applications is revolutionizing the way healthcare staffing operates. Let's start with staffing software. This technology has streamlined the recruitment process, making it faster and more efficient. It has automated many manual tasks, such as scheduling, tracking applicants, and managing employee information. This has drastically reduced the time to hire, enabling healthcare facilities to fill positions quicker and respond to staffing needs promptly. Then we have artificial intelligence, or AI. AI is playing a significant role in transforming healthcare staffing. It's being used to predict staffing needs, match candidates with suitable positions, and even assess skills through intelligent screening. This not only improves the quality of hires, but also helps to mitigate staffing shortages by predicting and preparing for future needs. And let's not forget about mobile applications. They have made healthcare staffing more accessible and convenient. With these apps, healthcare professionals can easily search for jobs, apply on the go, and even manage their schedules. For employers, these apps provide a platform to reach a wider pool of candidates and engage with them effectively. On the flip side, it's vital to remember that technology, while transformative, is merely a tool. It's the people behind the technology who make the real difference. So while we embrace these technological advancements, let's not lose sight of the human touch that is so essential in healthcare. Technology is playing a pivotal role in revolutionizing healthcare staffing. It's not only making processes more efficient and effective, but also empowering healthcare professionals and recruiters alike. As we move forward, we can expect technology to continue shaping the future of healthcare staffing in ways we can only imagine. What legal considerations are crucial in healthcare staffing? Let's delve into this. The legal landscape surrounding healthcare staffing is complex and ever-changing. It's essential to stay on the right side of the law and ensure the smooth operation of healthcare services. Firstly, compliance with labor laws is paramount. These laws protect the rights of employees and set standards for employers. They encompass a myriad of elements, from wage and hour regulations to health and safety standards. It's crucial for healthcare employers to navigate these laws effectively and ensure fair treatment of their staff. Next, navigating healthcare regulations is another critical aspect. These rules are designed to ensure the safety and well-being of patients and healthcare workers alike. They may include guidelines on patient privacy, infection control, and medical record keeping. Healthcare providers must continuously stay updated on these regulations and ensure that their staffing strategies align with them. Lastly, maintaining safe staffing ratios is a crucial legal aspect of healthcare staffing. These ratios dictate the minimum number of healthcare professionals required per patient based on care levels. They exist to ensure the quality of patient care and the safety of both patients and healthcare workers. Overlooking these ratios can lead to legal ramifications and compromise patient care. In conclusion, the legal aspects of healthcare staffing are multifaceted and require diligent attention. They encompass labor laws, healthcare regulations, and staffing ratios, each of which plays a vital role in shaping the healthcare workforce. Understanding and complying with these legal aspects is critical for effective healthcare staffing. Why is diversity so important in healthcare staffing? Well, let's delve into that. Diversity in healthcare staffing is about more than just a checkmark on an equality and inclusion form. It's a crucial component of providing quality healthcare services. A diverse workforce enriches our healthcare system with a broad spectrum of experiences, perspectives, and skills. This is particularly important in healthcare, where understanding the cultural and social nuances can significantly impact patient care and outcomes. Imagine a scenario where a patient feels more comfortable discussing their health concerns with a healthcare professional who shares their cultural background or speaks their native language. This comfort level could lead to more open communication, better diagnosis, and effective treatment plans. In addition to improving patient care, diversity in healthcare staffing also fosters an environment of understanding and respect among staff members. It encourages the sharing of diverse ideas and approaches that can lead to innovative solutions to healthcare challenges. But how can we foster a diverse and inclusive workplace in healthcare? It starts with a commitment to diversity at all levels, from the recruitment process to career advancement opportunities. Healthcare institutions should strive to attract and retain a diverse pool of talent. This could involve offering language classes for staff, creating mentorship programs, or implementing policies that ensure equal opportunities for everyone, regardless of their background. Inclusion is equally important. It's not enough to have a diverse workforce if we don't cultivate an inclusive environment where everyone feels valued and heard. This might involve regular diversity training, creating platforms for open discussion on diversity issues, or celebrating cultural events. Diversity in healthcare staffing is not just a moral imperative, but also a strategic advantage. It enriches our healthcare system with a wealth of experiences and perspectives, fosters innovation, and most importantly, it improves patient care. And in a field where the ultimate goal is to improve health and save lives, isn't that exactly what we need? How can healthcare organizations effectively manage their staff? In the dynamic world of healthcare, effective staff management is more critical than ever. Let's delve into 3 key strategies: onboarding, training, and staff retention. Starting with onboarding, a well-structured orientation can make or break a new employee's experience. Welcome new hires warmly, make them feel part of the team, and clearly communicate their roles and responsibilities. Equip them with the necessary tools, resources, and knowledge to successfully navigate their new environment. Remember, a confident start can set the tone for their entire journey with your organization. Next, let's discuss training. In the fast-paced healthcare industry, continuous learning is not just an option, it's a necessity. Regular training sessions help your staff stay updated with the latest medical advancements and best practices. Whether it's learning a new software or understanding a complex medical procedure, training empowers your staff to deliver the best care possible. And don't forget, training doesn't have to be tedious. Consider interactive and engaging methods like hands-on workshops, online courses, or even gamified learning. Finally, onto staff retention. Retaining your talented team members is just as important as attracting them. So, how do you keep your staff satisfied and motivated? Foster a positive work environment that encourages growth, recognition, and work-life balance. Regular feedback sessions can help you understand their concerns and aspirations. Also, consider offering competitive benefits and opportunities for career advancement. Remember, a happy, engaged staff is the backbone of any successful healthcare organization. Effective staff management is key to a successful healthcare organization. With these strategies in your arsenal, you're well equipped to build a dedicated, competent, and happy healthcare team. What role do staffing agencies play in healthcare staffing? Well, let's dive right in. Staffing agencies, or sometimes referred to as recruitment agencies, are the behind-the-scenes heroes of the healthcare industry. They serve as the bridge between healthcare facilities in need of professionals and the professionals themselves seeking new opportunities. So, how do they operate? Imagine a bustling marketplace. On one side, we have healthcare facilities, each with unique needs and specifications, from specialized roles to bilingual skills. On the other side, we have a pool of healthcare professionals, each with their unique skills, experiences, and career aspirations. The staffing agency is like the matchmaker in this marketplace, meticulously pairing the right professional with the right facility. Let's not forget the value they bring to the table. For healthcare facilities, staffing agencies provide access to a broad network of professionals. They take on the time-consuming recruitment tasks, freeing up valuable time for the facilities to focus on what they do best, providing healthcare. For healthcare professionals, staffing agencies offer a wide range of job opportunities. Whether you're a cardiologist, a nurse practitioner, or a medical assistant, these agencies can help you find a role that fits your skills and career goals. They also provide support throughout the job-seeking process, making it less daunting and more efficient. But the benefits don't stop there. Staffing agencies also help manage seasonal staffing demands and high turnover rates. They can rapidly scale the workforce in times of crisis, such as during a pandemic. So whether you're a healthcare facility grappling with staffing challenges or a professional seeking new opportunities, staffing agencies are there to help. They play an integral part in ensuring that our healthcare system operates seamlessly, providing care to those who need it the most. Staffing agencies can serve as valuable partners in managing healthcare staffing. How does healthcare staffing impact patient care? This question is more than just a simple inquiry. It's about understanding the vital role healthcare staffing plays in patient safety, quality of care, and patient outcomes. Let's start with patient safety. The right number of well-trained staff is crucial to ensure a safe environment for patients. When hospitals are understaffed, employees are often overworked, which can lead to fatigue and mistakes. Unfortunately, these errors can sometimes result in patient harm. On the flip side, adequate staffing can significantly reduce the risk of medical errors and patient injuries. Now, let's talk about the quality of care. Quality care goes beyond just curing ailments. It's about providing a positive patient experience. It encompasses everything from the accuracy of diagnoses to the empathy shown by healthcare providers. When healthcare facilities are adequately staffed, healthcare professionals can spend more time with each patient, leading to more accurate diagnoses and treatments. Furthermore, with a lower patient-to-staff ratio, healthcare professionals can provide more personalized care, enhancing the overall patient experience. Last but not least, let's consider patient outcomes. Research has shown a direct correlation between healthcare staffing levels and patient outcomes. In simple terms, when there are enough healthcare professionals to go around, patients tend to recover faster and have better overall health outcomes. They are less likely to be readmitted to the hospital and more likely to report satisfaction with their care. In conclusion, healthcare staffing is not just about filling vacancies. It's about ensuring that patients receive safe, high-quality care that leads to positive outcomes. So the next time you think about healthcare staffing, remember that it's not just a numbers game, it's about people's lives. Effective healthcare staffing is crucial for ensuring high-quality patient care. Remember this as we continue to navigate the complex landscape of healthcare staffing in modern times. What are the best practices for healthcare recruiters? A question that has become increasingly important in the evolving landscape of healthcare staffing. Let's start by understanding the healthcare landscape. It's a complex ecosystem with an ever-increasing demand for specialized professionals, from cardiologists to nurse practitioners, chiropractors to psychiatric nurse practitioners. The range is vast. Add to this the fact that some positions require unique skills like bilingual abilities, and you can see why this is a challenging terrain to navigate. But understanding this landscape is the first step to effective recruitment. Moving on to attracting top talent, the strategies could be as diverse as the roles themselves. However, some practices have proven to be effective across the board. Firstly, let's consider the power of an attractive job posting. It's not just about listing the roles and responsibilities. It's about presenting a comprehensive picture of what it's like to be a part of your organization. Showcase the workplace atmosphere, the advanced technology in use, the collaborative teams. Paint a vivid picture that appeals to the aspirational healthcare professional. Next, don't underestimate the impact of a comprehensive benefits package. In a competitive landscape, it's crucial to stand out. Think beyond the salary, consider training opportunities, career progression, flexible working hours, and health benefits. Make it clear that your organization values its employees and invests in their growth. Another key strategy is guiding potential candidates through the application process. Make it as smooth as possible. A user-friendly application process can significantly enhance the candidate experience and increase the number of quality applications. And finally, don't forget to utilize technology. Use staffing software, AI, and mobile applications to streamline the recruitment process. It not only makes your work easier, but also shows potential candidates that your organization is keeping up with the times. Following these best practices can enhance the effectiveness of healthcare recruitment. So, let's get out there and bring in the best of the best in healthcare. What is the impact of mental health issues and burnout on healthcare workers? Just as we take care to mend physical wounds, mental health is equally vital, especially among healthcare professionals. They're the backbone of our healthcare system, but the high-stress nature of their roles can lead to burnout and mental health issues, impacting their ability to provide quality care. Imagine a scenario where a healthcare worker is constantly exposed to high-stress situations, long hours, and emotional fatigue. Over time, these conditions can lead to burnout, a state of chronic physical and emotional exhaustion. Burnout can lead to decreased productivity, increased errors, and even a higher risk of physical health issues like heart disease. The scope of this issue is vast. According to a pre-pandemic study, nearly half of physicians reported experiencing burnout symptoms. With the added stress of the global health crisis, these numbers are anticipated to be even higher. This isn't just a problem for doctors, but nurses, medical assistants, and other healthcare professionals face similar challenges. Now, what can we do about it? There are numerous preventive strategies and management approaches to address burnout and mental health issues. Encouraging a work-life balance, providing access to mental health resources, and fostering a supportive work environment are all crucial steps. It's also important to normalize discussions about mental health in the workplace. By doing so, we can break down the stigma that often surrounds these issues, making it easier for those struggling to seek help. Moreover, healthcare organizations can implement strategies like mindfulness and stress management training. These can equip healthcare workers with the tools to manage stress, reduce burnout, and improve overall well-being. Addressing mental health and burnout is essential for maintaining a healthy and productive healthcare workforce. After all, our healthcare professionals take care of us. It's high time we take care of them too. What economic factors affect healthcare staffing? Well, let's dive into the world of economics and understand how it influences healthcare staffing. Economic factors such as recessions, inflation, and funding cuts often play a significant role in shaping healthcare staffing strategies. During times of economic recession, healthcare systems may face a squeeze. Budgets tighten, and hospitals may need to make difficult decisions about staffing. Fewer resources can lead to a decrease in the number of hired staff, impacting the overall quality of care provided. Inflation also affects healthcare staffing. As the cost of living rises, healthcare professionals may demand higher wages to maintain their standard of living. If healthcare facilities cannot afford these wage increases, it may lead to staff shortages or high turnover rates. Funding cuts, too, can have a significant impact on healthcare staffing. Reduced funding may lead to fewer resources available for hiring and retaining staff. This can be particularly challenging for public healthcare systems that rely heavily on government funding. Now let's shift gears and talk about career paths in healthcare staffing. The economic landscape influences the attractiveness of different healthcare careers. For instance, in a thriving economy, more individuals might be drawn to careers in healthcare due to the promise of job security and competitive salaries. However, in an economy in flux, these same individuals might consider different career paths that seem more secure or lucrative. So what does this all mean? It means that economic factors can greatly influence the number of available healthcare professionals, their job satisfaction, and ultimately, the quality of patient care. Understanding these economic factors is crucial for strategic healthcare staffing. By recognizing and responding to these influences, healthcare systems can navigate economic challenges and ensure they have the right staff in the right places at the right times. What have we learned about healthcare staffing in modern times? As we journeyed through the complexities of healthcare staffing, we've highlighted various significant trends, challenges, and strategies. Let's take a moment to distill these insights. We've seen the rise of telehealth and the increasing demand for specialized healthcare professionals mirrored by the challenges of staffing shortages and high turnover rates. Yet, through these turbulent waters, we've seen resilience. We've seen how healthcare institutions rapidly scaled their workforce during crises like COVID-19, embracing telehealth and fostering international cooperation. Technology, too, has made its mark. From staffing software and artificial intelligence to mobile applications, these tools are reshaping the landscape of healthcare staffing. Meanwhile, legal aspects, from labor laws to healthcare regulations, underscore the importance of compliance and safe staffing ratios. We've also touched on the importance of diversity in healthcare staffing, the role of staffing agencies, and the impact of healthcare staffing on patient care. We've discussed best practices for healthcare recruiters, the implications of mental health and burnout among healthcare workers, and the economic factors that influence healthcare staffing. But what does this all mean for a healthier tomorrow in healthcare staffing? The synthesis of these insights propels us forward. It's about navigating these challenges strategically, harnessing technology wisely, and fostering a diverse and inclusive workforce. It's about prioritizing mental health, understanding economic factors, and ensuring that the quality of patient care remains at the forefront of all staffing decisions. From these insights, we can work towards effective staff management, from onboarding to training to retention. And we can understand the pivotal role of staffing agencies and the impact of healthcare staffing on patient outcomes. These are not just lessons, but stepping stones towards a healthier tomorrow in healthcare staffing. As we continue to navigate this ever-evolving landscape, we're equipped with valuable knowledge and insights to guide us. By understanding these trends, challenges, and strategies, we can navigate the complex landscape of healthcare staffing and work towards a healthier tomorrow.